Good morning. Thank you for tuning in to the Ministry of Health's virtual media conference. These live conferences are your most accurate and reliable source of information on the national COVID-19 response. And just a reminder, everyone, tomorrow, Sunday, the 10th of October, we join the rest of the world in commemorating Mental Health Day. The theme this year is Mental Health in an Unequal World. Together we can make a difference. And if you want information on support, mental health support, or psychological support, go to the Ministry of Health's website at health.gov.tt or www.findcareTT.com. And this morning in studio, we have Dr. Roshan Parashram, Chief Medical Officer. We have Dr. Avery Hines, Technical Director of the Epidemiology Division at the Ministry of Health, and Professor Christine Carrington, Professor of Molecular Genetics and Virology at the University of the West Indies. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will moderate this morning's conference. We begin with Dr. Parashram, who will give us the clinical update this morning.
Good morning. Thank you, Ms. Alcantara. Good morning to Dr. Hines, Professor Carrington, members of the media, members of the viewing and listening public. We'll begin with the first slide, which shows the COVID-19 update for October 2021. And we see the test at the top of it. Public and private facilities now stand at 359,405. Total new positives over the last 24 hours, 184. Taking our total since March 12, 2020 to 52,263. Our total recovered patients so far, 46,503, leaving a total active positive case load of 4,224. Of those, 3,715 are in home isolation, 269 patients are in hospital, and 56 of those are in step-down facilities. In terms of our quarantine sites, we had 111 persons in quarantine at this time, and our deaths now stand at 1,536. And once again, condolences to the families of all of those who would have lost loved ones during the pandemic. In terms of our vaccination figures, it varies a little bit from what you see on your slide. So this would have been up to 8 p.m. as of yesterday. The slide would have been 4 p.m. So partial vaccination, total persons vaccinated with the first dose of a 2-dose regime, 595,259, which represents 42.5% of the population. Completed vaccination, total persons vaccinated with the second dose of a 2-dose regime, 518,687. Total persons with a single dose, Johnson & Johnson, 24,575, giving us a total persons completed the vaccination regime at 543,262, which accounts for 38.8% of the population at this time. If we can have the second slide, please. So just to say, as we are on vaccination, the percentage change, which we will do every Wednesday in our update, in terms of the percentage of patients in the parallel healthcare system who are not fully vaccinated, stands at 95.1%, meaning 95.1% of the people who were hospitalized during the period July 22nd to September 22nd, which is 3,549 of 3,732, were not fully vaccinated. This slide just gives a little additional data, and we can't see it very clearly, but I will focus on the last bit of it, which is the Ministry of Health advice to the population that as of yesterday, we would have confirmed 10 additional cases of the Delta variant of concern. This brings the total number of cases so far up to 42, of which 9 cases had no travel history, 5 cases had positive contact with other positive cases, 3 cases had no contact with positive cases, and all cases, as I said before, was confirmed by the University of the West Indies via the TPHL and CAFA labs. If I could have the last graph. Yeah, so the last graph focuses on the hospital occupancy, and I'll give you what is off the screen in terms of a percentage. And we look at our overall occupancy for Trinidad and Tobago, 32%. That for Trinidad, 32%, and for Tobago, we stand at 34%. As it breaks down in terms of different facilities, we have Cora at 20%, CMMF, which is the Couva Hospital, at 25%, Augustus Long at 87%, Arima General Hospital 47%, Tobago, Scarborough Regional Hospital 34%, Point Fortin at 55%, St. James 84%, and then of course the Tacarigua and Step Down facilities are 32% and Davie at 28% respectively. Ms. Alcantara, I think that brings me to the end of my clinical update for this morning. Thank you for the brief time this morning.
Thank you very much, Dr. Parisram. And as usual, we go to Dr. Hines now for the epidemiological update.
Thank you, Ms. Alcantara. Good morning to the CMO. Good morning to Professor Carrington. Good morning to members of the media, members of the viewing and listening public. If we can go straight to my first slide, we will go directly into the epidemiologic update. Next slide, please. If we look at our epicurve, we would see that we have introduced a new color over to the right. And we're giving advanced warning that the gray section over to the left, representing the 2020 data, will at the end of October, we're going to just remove that section so we have a little more space to add the remaining months for 2021. So the green color all the way over to the right is now the data for the daily cases that we've been detecting for October. And so far, we're seeing that, again, that rolling average is remaining in the vicinity of about 200 cases a day. The heights of the bars are more or less similar to the heights for the preceding months. And that really just indicates the continuation of the plateau that we've been speaking about, meaning a fairly consistent number of cases from day to day and week to week over the past 3 months or so. If we go to the next slide, we see again similar information, this time aggregated at a weekly time scale. The green color again representing the new data for that first week in October. And the heights of those bars representing weekly aggregates, again being relatively similar. They will fluctuate and there will be some small changes. We've seen alternating directions of changes for the last maybe 9 or so weeks, where one week it will go up a little and the next week it will go down a little, and it's been continuing like that, which is basically how a plateau will manifest itself in a real life setting. And that has continued through to week 39. We're completing week 40 by the end of today. So the total for the end of today will be what we determine whether we have gone up or down for this week 40 when we get that particular bit of data in. Looking at the background, that salmon color again represents the positivity, that percentage of COVID swabs that come back as positive, and that has hovered largely between 25 and 30% for the last several weeks. It dropped a little in this first week of October. Let's see what happens, or rather in the last week of September, and began to rise again a little in the first week of October. Let's see where that trend goes. But again, it's been hovering in the same range over the last 3 months or so, along with the numbers of cases hovering around the same number from week to week. If we go to the next slide, we see that that same pattern is now played out on a monthly time scale, where the new green bar is October. The 3 that preceded will be July, August, and September, and you see that those are all approximately the same height, again representing that plateau or similar numbers from one time scale to the next. And the variation in positivity, that salmon background, again ranging between 25 and 30% for those 3 months, July, August, and September, and being for this first week of October just a little below 25%. Let's see what happens as we move forward. Next slide. From a demographic perspective, looking at the age and sex distribution, we see that the pattern continues to maintain itself. The majority of those cases being in the 25 to 49 year age group, and just about 50% male and female distribution among the positives. Whereas, if we look at the fatalities, when we move to the next slide, we see that about 2/3 of the cases who have passed on have been individuals over 60, and that there's slightly more men than women, looking at about a 58% to 42% distribution of male versus female. Of importance, what we've noted is that many of these individuals have had comorbidities, both the older and the younger ones, And since the launch of the vaccination program, we've noted that the vast majority of the deaths that have been occurring have been in those individuals without any vaccination on board. So again, it's a point to encourage people with comorbidities, and in fact everybody in the population, to make use of the available vaccinations to reduce your risk of having an adverse outcome. Next slide, please. If you look at the geographic distribution, go ahead. We see that, again, where there are population centers, we see some of the larger numbers of the darker colors, and this is looking at the info by community within the various counties. If we aggregate that, next slide, to the county level, we see that from 1 week to the next slide, thank you. From 1 week to the next, if we look at the purple bars or purple dots as the data representing the previous week, and the gold as the data representing the most recent week, we see that in most counties, there was either a plateau, a similar number of cases from the week 38 to week 39, or a small decrease, with only currently actually registering an increase. The others were small decreases in a few of the counties and plateaus in the others. So again, this bears out the overall national picture of overall the same number of cases occurring from 1 week to the next over a prolonged time period, but there's slightly different patterns of spread in different parts of the country. And again, we just want to make sure that people understand that the rate of spread of the virus is going to be affected by the same things no matter which variant is in circulation. So if we adhere to the public health regulations, if we keep the masks on, if we don't gather when we're not supposed to, if we stay out of gatherings when we're ill, and if we get our vaccinations, these are the things that are going to help us slow the rate of spread of whatever variant of the virus is in the population. So going to the last slide, we're just looking at that same information now over a multi-week time scale, and you see that whereas some counties have had similar numbers throughout, you see that the last couple of weeks, last 3 weeks or so, the bars to the right-hand side of any of those groups, some have seen a slight downward trend, some have seen a slight upward trend, and some have seen a plateau. And again, that really just represents the variation from one geographic area to the next, but the overall outcome being similar numbers at the end of the week, from 1 week to the next. So with that, I'm going to turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. As mentioned by the Chief Medical Officer, yesterday Trinidad and Tobago confirmed an additional 10 cases of the Delta variant of concern. And so we have Professor Carrington here with us to give some current insight into variants of concern.
Thank you, Ms. Alcantara. Good morning, Dr. Parasram and Dr. Hines, and good morning to Trinidad and Tobago. Now, like all viruses, SARS-CoV-2, the virus which causes COVID-19, has been evolving over time. And this having given rise to many different lineages of the virus. Now, each lineage is like a branch of the virus's family tree, and each lineage can be distinguished from other branches based on the presence of sort of changes in the virus's genetic material known as mutations. Now, as I've said before, most mutations have little or no effect on the virus, so that the lineages that carry them, they behave very similarly. However, some mutations give particular lineages an advantage over the other lineages, allowing them to spread more quickly, for example. Others have mutations that allow them to more easily escape some of the body's defenses and to cause more severe disease. Now, these slightly different versions of the virus are sometimes referred to as variants of the original virus, and those that have properties such as those mentioned above, able to spread more quickly or to escape some of the immune response, those ones that have a significant public health impact are called variants of concern. Now, the WHO recommends that countries monitor and track variants of concern, that they carry out surveillance for new variants and share this information with the global scientific community so that when significant variants are detected, countries may be informed about how best to react and prevent their spread. This type of surveillance can be done by regularly testing samples from individuals who have been infected with the virus using a technique called whole genome sequencing. And at the University of the West Indies, we have been carrying out this type of genomic surveillance using whole genome sequencing of SARS-CoV-2 on behalf of the Ministry of Health and CARPHA since December 2020. Now, it's important to note that genome sequencing is not the same as PCR testing. PCR testing is used to detect whether the virus is present or not. The genome sequencing is a more complex and time-consuming technique that reveals the detailed structure of the virus's genetic material, and it is the only way to detect and fully characterize new variants and to unambiguously type the existing ones. So if we look at the slide here, to date, we have detected in Trinidad 3 of 4 variants of concern that are recognized by the WHO. Those are the ones that are recognized by the WHO are alpha, beta, gamma, and delta. And to date, we have detected alpha, gamma, and delta in Trinidad. Of those, the gamma and delta variants, we have evidence of community spread for those. In the case of the gamma, that was first detected several months ago, associated with community spread. And then, of course, more recently, we had evidence of community spread of the delta variant, which research suggests is more easily spread from person to person than the other variants, and also more easily spread than the original Wuhan lineage of the virus. There's also evidence that individuals who contract the Delta variant are at higher risk of experiencing severe disease and of being hospitalized. But at this stage, I'd like to echo what Dr. Hines said. All COVID-19 variants and lineages, the original and the ones we have now, they all are a risk to our health. They all can cause severe disease. They can all cause hospitalization and death. And all of them will respond to the type of interventions that we recommend. Okay, so it's not, while the Delta variant is more easily spread and of course of concern, we have to be concerned about SARS-CoV-2 and COVID-19 in general. To date, there are other so-called variants of interest, such as Mu and Lambda variant. These have not been detected in Trinidad and Tobago to date in the samples that we've tested, but they have been detected in other countries in the region. Now, recently, there has been some speculation in the public about the presence of undetermined variants. This apparently stems from an inaccurate news report out of Grenada that has been circulating on social media. And the report claims that batches of samples sent from Grenada and Barbados to CARPHA for whole genome sequencing were shown to contain an undetermined variant and that further research was needed. I can assure you that there is no undetermined variant. No undetermined variant was discovered among the samples from Grenada or Barbados that underwent whole genome sequencing when were sent to Trinidad for whole genome sequencing. I am absolutely certain about this because it is my lab at UE that does the sequencing, and I report the results myself to the CARPHA and to the Ministry of Health. Now, this erroneous news item appears to have arisen from a misinterpretation of the genome sequencing results provided to the countries. You can think about genome sequencing like putting together a jigsaw puzzle. If you're able to extract enough pieces of the virus's genetic information from a sample and work out their positions in the virus's genome, you can work out what lineage you are looking at and whether it is a variant of concern. You don't have to have all the pieces. You don't have to retrieve all the pieces. But the more you have, the more certain you are about what lineage it is and whether it's a variant of concern or not. Sometimes samples are not of sufficient quality to get enough pieces of that puzzle to build enough of a picture to work out which lineage the virus belongs to. And in those cases, if you have to answer the question, is this a variant of concern, you cannot say yes or no because you do not have enough information. You can only say that you do not know, you cannot confirm, the sample was inadequate. And this is where I think the misinterpretation of those results stemmed from. What happened with those samples is that due to their low quality, we were not able to confirm what lineage of SARS-CoV-2 was present in the samples, and therefore the result could not be determined. So the result could not be determined, not that there was an undetermined variant. as was unfortunately reported in that news article. It is not unusual for some samples to reach the lab in less than perfect state because of the complexity and the length of the logistics of getting the samples from the sites to the lab in UAE. So next slide, please. To end, I just want to remind the public again that the vaccines we have are safe and that they're effective even against these variants. Compared to unvaccinated people, fully vaccinated individuals are less likely to get infected by the virus. They are less likely to get sick if they are infected by the virus, less likely to transmit the virus to others, much less likely to experience severe disease or to be hospitalized with COVID-19, and much, much less likely to die from COVID-19. So once again, I urge you to get vaccinated to protect yourselves, to protect your family, to protect our healthcare system, and to protect our country. Thank you.
Thank you very much, Professor Carrington, for that clarification. And we go now to the question and answer segment. We ask members of the media to please indicate your name and the name of the media house that you represent before posing no more than 2 questions, and please keep them brief. Ask both at the same time so we can get as much responses in as possible this morning. We begin with Guardian Media Limited. Are we ready with Guardian Media Limited?
Yes, are you hearing me?
Yes, good morning.
Yes, good morning. I've got 2 questions. The first one is with regards to
sorry, sir, just indicate your name for us, please.
Raphael John Lal.
Wonderful.
Guardian Media.
Welcome to the conference.
Yes, I have 2 questions. The first one is with regard to the Delta variant death. Professor Carrington just spoke about how easily spread it is. Is the local medical system prepared to deal with a surge in such cases? And my second question deals with the reopening of bars in the safe zones on Monday. We would have seen some cases earlier this year of persons being charged for consuming alcohol in public during the state of emergency. For people who are not clear how they should go along purchasing and then consuming alcohol from Monday when bars are reopened, how does the health regulation deal with these cases?
Thank you very much for those questions. I do believe they're probably better posed to Dr. Hines, and CMO I think will handle those questions. Yeah. Let's go to Dr. Hines first.
Okay, the first question being the question regarding the Delta variant and the ability of the health system to deal with a surge. First of all, what we're trying to emphasize is that all of the actions that we are continuing to encourage are the actions that are meant to reduce the risk of or to dampen the rate of any potential surge. So we are hoping that the understanding in the population is that we need to continue all the things that we've been advising and advocating in order to reduce the risk of a surge. And the health system, as it has been organized with a parallel healthcare system to take the brunt of the increase in any COVID-19 cases and admissions, that system stands ready to deal with anything that comes to it. Our job at the outside is to reduce the risk of overwhelming the system by continuing to adhere to the guidelines. So I'm hoping that we understand both sides of it. It's not just whether the health system is ready, but the population also has to be ready to prevent a surge so that the health system can deal with whatever comes to it. So I'll turn you over to the CMO for the next bit of the question.
Yeah, so thank you for the question. I would have held a meeting yesterday with the Trinidad and Tobago Police Service, the regional corporations, as well as my public health inspectorate to discuss enforcement around matters related to the safe zone, and the question did arise. So my legal advisor would have advised that we are in a state of emergency still, which debars the consumption of alcohol in public spaces. There's under the public health regulation as well, from a health perspective, it delineates that within these establishments that are to open as safe zones, it also is entrenched in the public health regulation that alcohol is not to be consumed on the premise or in the precincts in some instances. So for further details, of course, the Attorney General's office and the Office of the Legal Affairs will be able to shed further light in terms of the intricacies of it. but the police service has been dealing with this for quite a while now, and they assure us that in terms of enforcement, that they will be able to do their part as it relates to the regulations.
Thank you very much, CMO. We go now to TTT.
Good morning. Terry Ann Brown Campbell from TTT News. I have two questions. My first question is for Dr. Hines. If he could indicate what areas of Trinidad the Delta variant, what communities in Trinidad the Delta variant is showing up in. And my second question is I would like to have an update on the number of children who are in the system at this time with COVID-19. Thank you.
Okay, thank you for the question. Now, at this point, across the 42 or so cases that we've had cases show up in almost every community or every county so far that we have. So we have 9 counties, and we've seen cases in each of them across that time span. Now, the other thing that we need to bear in mind and keep in mind is that the pattern that has shown up from the epidemiologic investigation suggests that they are what we call undetected chains, because we're seeing people showing up that don't have a link directly to travel, don't have a link directly to somebody who traveled. So therefore, we have already labeled the pattern as being community spread, and that means that whether or not your particular community or neighborhood has been listed as one where a case has been seen, we should all be taking the extra precautions to reduce the risk of encountering somebody with the Delta variant, because of the fact that it can be in places that we have not yet actually documented. So when we say that potential for community spread, we want the entire population to take that seriously and enhance their precautions so that we can reduce the risk and the rate of transmission of the new variant.
Thank you, and
okay.
CMO.
Yeah, so just to give you the pediatric update, right now we have 2 persons under 18 in the system, 1 person at the Couva Hospital and 1 person in the DB step-down facility. Just to add to what Dr. Hines and make it a little simpler, we have Delta variant cases, variants of concern that is confirmed in every county in the country, including Tobago. So it is as widespread as it can be in terms of community spread, and we're trying, by the question, I think implicit in it, we're trying to identify areas of concern. The areas of concern are all areas of Trinidad and Tobago.
Thank you very much, CMO, for that reality check. We go now to CL Communications, please.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. I was just wondering, now that a determination has been made on that report out of Grenada concerning the sample, is Trinidad going to communicate back to Grenada to perhaps retract the report or correct the report? And then secondly, what further assistance is going to be given to Tobago, given that there is 1 case in Tobago, and in terms of like resources, then what assistance is going to be given to Tobago? And I was just wondering an update on the Trinidad Public Health Labs, given that it's more cases of Delta variant in the population. Thank you.
Okay, Professor, we'll take question 1, and then we'll go back to CMO for question 2.
Okay, I'll make it very clear that there was nothing wrong with the report. There was no wrong information conveyed in the report from the labs in Trinidad and Tobago. What happened is that the report was misinterpreted on the other end. Okay, so there's nothing to retract. The report said that X number of samples came in. Some of them were Delta, some of them were, other lineages, and for some of them it said cannot confirm, which means that it was an inadequate sample, and therefore no result could be given from that sample. So that was misinterpreted, and that is no longer, so there's nothing to retract from the lab. It is the report was correct.
Yeah, in terms of Tobago, having confirmed the Delta variant, it is 1 country, 2 islands. Once you have Delta in one area or you have COVID-19 in one area, you expect that eventually it will be picked up in Tobago or Trinidad, vice versa. So we have always been in collaboration with the Tobago Regional Health Authority as well as the Tobago House of Assembly as it relates to their response, and it is a national response for Trinidad and Tobago. So we even up to a couple of weeks ago, we would have had a site visit where an anesthesiologist together with a microbiologist, a nursing practitioner would have visited our colleagues in Tobago. We have constant communication through the offices of the CMOH and the Chief of Staff there with my office as well. So we are constantly in contact, bearing in mind, of course, their capacities are a little bit less and they're a little more isolated because they're on their own in Tobago. And we have systems in place to assist since the beginning of the pandemic as it relates to COVID-19.
Thank you very much. And we go now to TV6, please.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question is for Dr. Parasram. Dr. Parasram, can you give us a bit more information on these 10 Delta cases in terms of the counties that they were found? And I know initially, the different counties that these 10 Delta cases came from. And I know initially you had stated that most of the Delta cases we are seeing presently in Trinidad are asymptomatic or experiencing very mild illnesses. I was wondering if that has changed, if we are seeing people being hospitalized with Delta. So that's the first question. Second question is for Professor Carrington. Professor Carrington, I saw a report that stated that Delta had displaced Beta had almost displaced Beta in South Africa, and I was wondering if you could delve a little bit into that for me. How does one variant almost displace the other one? Thank you.
Yeah. So just in terms of the breakdown that we would have gotten, we have 2 cases from St. George Central, 2 from St. George East, 3 from St. Andrew St. David, 2 from Caroni, and 1 from the New River Mayaro area. As I said before, it has been detected in all counties of Trinidad, and it has been detected in Tobago as well. We expect, based on what Dr. Carrington would have said and based on the research, that Delta variant will present itself as possibly a more severe form of the disease in terms of hospitalization, in terms of even requirements for ICU and oxygen need. So basically, what we are seeing is just a few cases so far. As the cases increase in number, we will see the wide gamut of clinical presentations across the board. But for now, we have seen some more, well, I wouldn't say more severe than the original lineage, but we have seen some hospitalization in Delta cases. But the predominant majority so far have been mild cases and sometimes asymptomatic cases. Professor.
Thank you very much. So your question is about displacement of one variant by another. You mentioned that you saw a report that Delta had displaced Beta in South Africa. This is what's happening throughout the world, okay? So in the UK, Alpha was the predominant variant there, and Delta has replaced that. Not entirely, but mostly. Also in the US, all the other lineages they found that Delta is emerging as the most dominant one. So it's not unusual. And the reason is that Delta appears to have a fitness advantage over the other variants. It can spread more easily. People who are infected with the Delta variant remain infectious to other people for a longer period than with the other variants, and so there's more opportunities for them to transmit the virus to other people. So in a competition, when the viruses are in competition for susceptible cases, the Delta is going to win out. And so you will see, or you do expect to see the Delta variant, because of that increased the rate of spread, becoming more dominant than other variants. So it would not be surprising if we saw that happening, as elsewhere.
Thank you very much, Professor. We go now to AZP News, please.
Hi, good morning. Private Harry, AZPnews.com. My question is for Professor Carrington. Can you say how many what percentage of samples taken by your lab are proven to be Delta, and also are there cases of other variants that the lab is picking up now, and what percentage? And can you also give us the numbers in terms of how many samples you have taken over the last year or something, and how many of those have been, what percentage, what numbers have been Delta and other variants? Thank you.
Okay, so before I answer that question, I just want to make it very, very... Sorry, before I answer the question, I just want to make it very, very clear that the percentage of positives amongst the samples that we received is not necessarily a reflection of the percentage in the wider population, because the samples we receive, not all of them are random samples, okay? So that's the first thing. The second thing is for Trinidad and Tobago, since December 2020, we have screened, I don't have the exact number, but it's certainly around 1,500 samples from patients that have come to us. And you heard that 42 of them were reported as Delta so far. Now, it's important to note that it's not as if we're not doing like a specific test for Delta. The whole genome sequencing allows you to identify any variant, okay? So we have seen, and remember the term variant is sort of used to describe sort of variants of concern, ones that have specific mutations, but there are many, many lineages of this virus circulating around the world. There's, over 1,000 lineages around the world. And some of them we've seen in Trinidad, but in terms of the ones that are of concern, variants of concern, those with those additional properties that impact public health, in terms of those, we have detected Alpha and Gamma and Delta. And Gamma and Delta are the ones that have been associated with community spread. I don't have the number for the Gamma right now, so I can't give you a rate for that. I would have to check my notes, okay?
Thank you very much, Professor Carrington. And just want to go to the Chief Medical Officer at this time. He just wanted to provide some additional information and remind us about the TT Safe Zone.
Okay, so I'm told by Ms. Alcantara that in today's Guardian, I believe we have a poster, which is the TT Safe Zone poster. It is beginning, as you all know, on Monday, 11th October. So certain businesses will now be allowed to operate under the Safe Zone, TT Safe Zone banner. Basically, it is applicable to the following spaces: people who provide leisure activities, for example, restaurants, in-house dining, bars, cinemas, theaters, private members clubs, gyms and fitness studios, water parks, gaming houses, betting pools, and offices. And of course, just a note to the owners and operators again, TT Safe Zone certificates must be prominently displayed at the business entrance. Businesses must comply with all the TT Safe Zone rules. Businesses must also comply with the public health measures, as well as, of course, operate in not in excess of 50% in terms of capacity. Employees must be fully vaccinated. Copies of the employee vaccination card shall be kept on the premises at all times, and vaccination cards must be easily accessible for inspection, verification by members of the Public Health Inspectorate and the Trinidad and Tobago Police Service. In terms of patrons entering the safe zones, all patrons must be fully vaccinated, and all patrons must have proof of vaccination, as well as, if possible, one form of valid photo ID on them at all points in time, and remembering to follow the public health guidelines as best as you can. It is all, we're trying to move forward in terms of different phases of reopening, but we want to do so safely, and we're really calling on the population to utilize these spaces, abide by the rules and regulations as set out in the public health regulation, and I think we can move forward in terms of having a little more relaxation as we continue to see continued a plateau in terms of what Dr. Hines would have presented, but we are trying to move safely into certain other aspects of movement of people that we would not have been able to do before we had vaccines in the country.
Thank you very much, CMO. Just a reminder to everyone, tomorrow is World Mental Health Day. Your mental health is just as important as your physical health. So take some time tomorrow, spend with the family, and do something that helps you to relax and focus on positives. So we've come to the end of today's media conference, reminding everyone to do your part. Follow the 3 W's. Watch your distance, wash your hands, and wear your mask, of course. And a reminder as well, TT Safe Zone at health.gov.tt. That's an email that people can send, an email address that people can send their complaints or concerns to. We start TT Safe Zones on Monday, as CMO said. So please, everyone, do your part to ensure that this is a successful venture. And one other key important thing that Professor Carrington raised today in the Corporate Communications Unit, we get this question all the time, and I'm very happy that Professor Carrington addressed it today. When compared to unvaccinated individuals, persons who are fully vaccinated against COVID-19 are less likely to get infected by COVID-19, less likely to transmit, less likely to get sick if infected, and of course much less likely to have severe disease. And unfortunately, we also have had persons who have died from COVID-19. So if you're fully vaccinated, your risk of dying from COVID-19 is much less. So all of those are important reasons to get vaccinated. Everyone, please do your part. So let's get together. Vaccination locations are open today. Let us please vaccinate TNT.
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole world struggling to contain a pandemic and unprecedented amounts of scientific work taking place, the road to finding the COVID-19 vaccine looks more like this. But first, let's take a look at the usual path. During preclinical trials, the vaccine is tested on animals to determine whether they develop antibodies to the disease-causing germ. If these trials are successful, the candidate vaccine moves on to phase 1 trials in humans.